Hello, everybody. Thanks for joining in. This is Rafael Curiel at City of McAllen Employee Wellness. I'm joined today by Dr. Andie Gonzalez, who has some amazing information for us about uh, a thing that she works on called being a registered dietitian. Registered dietitians can do a lot to help people to find what it is that they need to make great choices for their daily eating, but then they also do other things above that. They help people with actual medical necessity as far as like what their eating needs to look like in order to get back to being healthy. And Dr. Gonzalez is here today to talk to us about how to support people's nutrition goals. I'm just going to go ahead and turn it over to her because I know she's got a lot of information for us. Thanks for being here today.
Thank you, Rafael. I'm so honored to be with you all this afternoon. My name is Dr. Andie Gonzalez. I am a registered dietitian with Complete Nutrition Solutions and really excited to be sharing some information with you all this afternoon. So again, I just want to say thank you for those of you that are joining us, those that are not able to join us at a later time. Welcome again to our program today. So just a quick introduction of our program at Complete Nutrition Solutions. We are a total of 5 registered dietitians that are supporting our program. Together, we have over 20 years of experience. And as Rafael mentioned earlier, we do provide high quality, patient-centered nutrition care. It's individualized, and we will always go over and beyond to support the needs of our patients. And what I mean by that is that, whether it's disease management for diabetes, cholesterol, hypertension, or even lifestyle. So if somebody is trying to pursue a specific meal plan or a specific lifestyle like veganism, low FODMAP, you name it, keto, low carb, plant-based, you name it, we can be able to support any of those nutritional needs. To get started, I also would like to share that we are a fairly new program. Together, our dietitians have over 20 years of experience, but our program initially kicked off fully as of July 2020, and we continue to expand as far as our program offerings. As of today, as I mentioned, we do have 5 dietitians that are supporting our program. Our dietitians are bilingual. We have a variety of different backgrounds and specialties. Our program today is in network with most insurance carriers, so which does include the City of McAllen's benefits. And then also, I do also want to mention that we also have 2 locations that we support that supports our program. We have a location in McAllen on Main, which is not too far from many of you, and then also another location in Wesco. As far as our goals and our program itself, we do have a mission as 2 dietitians that are very passionate about nutrition and health. Our ultimate goal is to really help empower and inspire healthy habits here in the Rio Grande Valley. When we think about the role of the registered dietitian, it's something that we're super proud of. We're super passionate, and our experience, our education really level up to being able to provide that support. Again, we do have 2 locations that we provide these services at, McAllen and also Wesco. But then I also want to mention that, some of the barriers when it comes to connecting with a dietitian is that sometimes we don't have, different methods of transportation. So we do also offer these services virtual and also by phone. Again, just offering that convenience. We know through COVID, it's brought a lot of different challenges. And so we want to connect with patients in any way or form to be able to provide that additional coaching and guidance. As far as our company's values, we are a company that's centered around patient care and people and health. We do believe in integrity, equality, and transparency. We're also really diligent about providing the best patient experience and customer care. And so we're always open to feedback and suggestions. And so as you all, try out our program or give us a chance, this is something that we do take a lot of pride in, are always asking our patients, like, how did it go? Did it meet your needs? Because we're always looking for ways of growth and development and being able to meet those needs. So this is our team, like our core team. As I mentioned, my name is Dr. Andie Gonzalez. I am one of the registered dietitians and owners. We also have Ana Descrevan, who is also my partner as far as this program goes. And then we have some additional support. And I think this is important because oftentimes the first step that employees will ask us is, how do we get started? How do we connect? And so we'll be sharing our contact information at the end, but we have two lovely admins that support all of our schedules. They're our backbone. They're the heart of our program. They provide a lot of the necessary things to be able to get that appointment scheduled. And then we also have Jack Patron, who takes care of all of our billing, all of our coding. And then we also have one other person that we just hired on that helps support all of our credentialing to make sure that we're in network with all carriers and to be able to support us as we continue to grow our program. So, when it comes to our team, we continue to grow. These are our lovely dietitians. And I don't know if you all know, but today is Dietitian Day. And so it makes me very proud, even more prouder today to be with you all this afternoon. But these are our dietitians that help support our program. We have Cherise Martin, Angela Acosta, and Miriam Zoe. And again, along with myself, Ana Descrevan, that also support the program. All of our dietitians have different backgrounds, as I mentioned earlier, different specializations. So for example, Cherise Martin is really specialized in eating disorders. And then we have other dietitians that are currently in the process of becoming certified diabetes educators. So Ana Descrevan is a certified diabetes educator, but then we have Miriam Zhao and Angela Acosta that are really specialized in family health and also pediatrics. So again, just trying to cover all of our community's needs when it comes to nutrition. As far as how to connect with our team, as I mentioned, it is a covered benefit under your plan. So it just depends on diagnosis. So I do want to provide that transparency as far as what that might look like. Oftentimes it does require a copay. Again, it just depends plan to plan. We do also offer affordable cash options. And as I mentioned earlier, when it comes to nutrition, anywhere nutrition can touch as far as our daily lives and quality of life, we could be able to help support. So whether it's diabetes, heart disease, weight management, as I mentioned, family health, pregnancy, GI issues, so anything digestive wise, we could be able to support, meal planning, nutrition support. So we have a lot of times that patients that might be requiring additional like tube feeding support. Our dietitians are specialized to be able to support those needs as well. Again, supporting across the lifespan from baby all the way to the elderly is where we are able to support. For example, me personally, and we always try to map out our patients to where those needs are. For example, my area of expertise has always been around pediatrics. But then we have Ana, who has worked across the lifespan, right? And so we kind of try to map out with those patients, again, to really meet those needs of that request. And at any point in time, you all have questions, please do stop me, or we can wait till the end as well, as we'll open it up for questions. As far as our current services or offerings, we do believe in that one-on-one counseling, that individual support, because nutrition is so individualized. Through our genetics and just our environment, different factors and lifestyle factors as well. We do offer that in-person opportunity in McAllen and Westaco. Our virtual piece, we do offer, can be done through computer or your phone, just depending on your comfort level. But then we also do by phone, just regular phone call. Can be an opportunity as well. Again, just really meeting where the patient wants to be able to have that visit. In addition, we're really excited because as of December, we have invested in an InBody. So those of you that may not be familiar with InBody, we'll talk a little bit about what it is and what it can do for us as far as our health journeys. But we do have this test specifically available in our Westlaco location. Unfortunately, not in McAllen. And again, I'm an open book. We like to be very transparent about our offerings. In McAllen, we actually are renting out a suite where we provide all of our services. We do follow all HIPAA and privacy guidelines as providers, as healthcare providers. We're all licensed with the Academy of Nutrition and Dietetics, and we're all registered dietitians, meaning that we all at least have at least a 4-year degree, but I can tell you that most of us have more than a 4-year degree under our belt. Again, always growing and always learning. Then we also offer meal planning. So this is something that's super popular amongst our patients and employees. We do have this service available as well. The only thing that we always ask for this specific piece of service is that we do always ask for a full assessment. And again, the reason we're asking for an assessment is because we want to know if you, like broccoli. We want to know if you are eating, specific, proteins, right? And all of those food preferences, all of those food allergies, your medical history will help us develop a plan that's really going to meet your needs and help you stick with as well. I always give the example, like, if I know that my husband doesn't like broccoli, and if I give him a meal plan with broccoli, then most likely he's not gonna, stick to it. So again, we want to help you all be successful. And then we also offer group classes. So this is something that we kicked off with different groups in our community, providing, different virtual health topics with different employers. So this is definitely something that we can consider and continue to support if it is of interest. And the way that we use that is very similar to our platform that we're using today. We actually have webinars via Zoom where we can provide these services. One thing that we want to share with everyone this afternoon is that starting last month that we are offering InBody testing free with any appointment that is scheduled, that one-on-one appointment that is scheduled. So this is a service that we are providing currently. So those of you that have never heard of InBody, I'm going to provide just a quick background of what it is. So what does it do for us? So it's an easy and non-invasive body composition. It usually takes about 60 seconds to read if you've never tried this instrument before. A lot of gyms have it. We found it useful because it does help you measure fat, muscle, and also water content. Again, this is considered almost like the gold standard of being able to determine those components of how our body composition is distributed. It's a really great way to track also clients' progress. And that's why we feel very proud of introducing this instrument to our program. So how to measure this? So I really love this guide because some of us might be like, well, I've never done an InBody before. We usually will guide and instruct our patients or employees how to, be able to take this test without any kind of interruptions. And so we do ask our patients to remove their shoes and socks. We do have them wipe their hands and feet with an InBody tissue. So it's basically what it's doing is just cleaning off any kind of residue that you might have on your hands or your feet, any kind of oils as well, because naturally we build oil, we have oil in our body. And so it's a way for us to be able to take that off. We do ask for height, and then we do enter age into the machine. And then it actually then guides you. It's a live screen that will tell you the different instructions on how to hold the instrument. There's these two bars that extend on the sides of the machine where you will grip. And as you can see this figure in the bottom, you basically will stand on this machine, this scale, stand straight, and then wait until the test is completed. Again, taking about 60 seconds for you to be able to do that. As far as, what is body composition? This is important. I'm not going to get too nerdy with you all, but it is a method of describing what the body is made of. And again, everybody is individualized as far as how genetically we're made up, right? And so this will help us determine, where we're carrying more of that, protein, that fat, the minerals and body water composition. Body composition also can accurately show changes in fat mass, muscle mass, and that body fat percentage. This tool has been validated and can really help us as practitioners, as providers, develop these nutritional programs that are going to help you be successful. So how does the InBody work? So the easiest way that I always like to share with my patients is that it's a little electrode that goes through your body. So it is advanced. What it's called is a bioelectrical impedance analysis, or BIA, which is a combination of direct segmental measurements with multi-frequencies to measure that body composition. Because of the advancements behind our 4 pillars of technology, InBody does not use the empirical estimation based on age, gender, ethnicity, athleticism, or body shape, which allows InBody to provide more accurate and precise results, right? And so again, the two things that it's asking for is your height and then also your age and your gender. I forgot the gender as well. And again, so this is just gives you a different perspective of how your body changes over time. As far as InBody, as far as how accurate it is precise as far as being able to validate. It is a gold standard method. And to date, InBody devices have been used in over 2,500 research studies. Again, showing the benefit, showing the true precise results when it comes to body composition. This is how the report looks like. So you might be wondering, okay, what is this instrument? What will it provide for me after I stand on it for about 60 seconds? So it will estimate a few things with you. I'll mention 3 specific ones, but I do want to acknowledge that to get a full, thorough report, it would be done by the provider as far as, what these numbers tell us and how it could benefit us as we continue our health journeys. So